Good morning, good afternoon, and good evening to YPOers and friends around the world. Welcome to this global conference call webinar featuring Christian Angermeyer. For those new to these calls, I'm Dick Simon. I've been a YPOer for over 20 years, founder and chair of the YPO Psychedelic Medicine for Mental Health Group. And for the past several years, I've been focusing all of my efforts on mental health and advancing the potential of psychedelic therapies for treating mental health issues through work with nonprofits, businesses, and research centers, including Mass General Hospital's new Psychedelic Research Center. So today's format is going to be a fireside chat followed by question and answers. So you will see that you've got a question tab generally on the right of your screen. And if you have a question, submit it there and we'll have a chat and then we'll get to the questions that everyone is asking. So we're very grateful today to have Christian Angermeyer joining us. He's the founder of ATAI Life Sciences, which addresses the mental health care crisis. Christian's created, co-founded, and invested in numerous successful companies and has raised $2 billion for his portfolio companies and has been involved in more than 40 successful IPO and M&A transactions, either as an entrepreneur, investment banker, or advisor. Christian, welcome, and please tell us a little bit about yourself and how you got into this space.
Okay. Yeah, first of all, welcome everybody, wherever you are in the world. I just had the pre-discussion with Dick, so we all get accustomed, I think, to Zoom very quickly. So I'm actually start enjoying Zoom calls very much, and but I think even beyond the crisis, we will going on with that because it works connecting with a lot of people at the same time. So just thanks for dialing in, thanks for taking the time, thanks for having the interest in the psychedelic world for whatever reasons, and we can touch more or a lot of reasons why I think it's a very exciting sort of topic to talk about, to be in. So how did I come in? Well, my story is always very, I think, not unusual, but like very funny and yeah, and maybe a tiny bit unusual because first of all, I literally, and for the ones who don't know it, I'm German, which maybe the accent tells you, and I'm coming actually from Bavaria, which is the southern part of Germany, where beer is sort of our basic nutrition, and for various reasons that maybe is too long for that chat. We can touch base it later if we have time. I've never drank alcohol in my whole life. I just decided not to because I think it's a very toxic substance. I've never smoked a cigarette. I've never smoked a joint. I've never took anything else because mainly, meaning again, there were some deeper reasons, but sort of the superficial reasons was I'm really like sort of a hypochondriac, you might say, I'm always scared about my health, or I want to phrase it positively. I want to live very long and very healthy. This is, by the way, one of my other areas of interest is longevity investments, because I think life is awesome and I want to enjoy it for a very long time in a very good state. So, and all of what I told you just now, I told at a birthday party around about 7 years ago to one of the most famous neuroscientists in the world, a German guy who is sort of the drug czar of Germany. And actually my friends had set him up to meet with me at the birthday party with a little bit the intention. He said, come on, you're a famous scientist. You can tell Christian that he can drink a glass of alcohol with us. So they wanted me to actually get drunk that evening for the first time in my whole life. It didn't work out because I was bluntly asking him, I said, can you tell me that alcohol is good for me? Yeah, and he was like, well, I really can't. It won't kill you if you do it one evening, yeah, but it's not really good for you. It's a toxic, it's a very bad stuff. So, and we started discussing about health and brain and all of that. And he showed me, which some of you might know, and who doesn't should go on the internet right now and Google it. If you Google David Nutt, N-U-T-T, and then chart for chart. Yeah. So David is a famous other neuroscientist here in London, and he made this famous chart about the risk of drugs, legal and illegal drugs. Yeah. And by the way, one of the extreme things of the chart is that it shows you that heroin, yeah, which everybody thinks is the worst, in a total assessment of risk, is just the second worst. And alcohol is actually, if you assess all risks related with it, short-term, long-term, is considered the most risky drug. And then in the chart at the very end, practically riskless were magic mushrooms. And he was like, look, if you want one advice, your friend set me up to tell you to drink alcohol. If you want one advice in life, take magic mushrooms. And I was like, holy shit, you're insane. Yeah, I just told you I never drank alcohol. I will not do an illegal drug, at least in Germany. So, and he started talking about his research and he actually, by the way, Dick, you don't know that, and it's very interesting. He did his PhD with Albert Hofmann. So he was one of the last guys who worked with him in science. Yeah, so he's very into that. So he told me all that and said all the science we will discuss today. And short version is, he said, look, taken in the right context, that's very important. They have super little, practically no risk, but enormous upside, obviously on the medical side for depression, anxiety, addiction, whatever. But in general, again, I need to be careful in the right legal setting. Yeah, they also make a healthy person even more happy, content. So they add a lot to your life. Yeah. So I was like, well, no, thank you. So I was not the one who jumped right on it, but I started because I do invest a lot in biotech, which is one of my core investment themes. So I started to look into the science, yeah, and actually the science, which goes back till the 40s, till Albert Hofmann, yeah, is incredibly compelling. Yeah, meaning there are really little substances, yeah, in the medical world which have that little side effects, again, in the right setting, and that positive effect. So these drugs, or some of them, should have never become illegal, and they were legal before in a medical setting for treating mental health issues. So I got familiar. Again, I do biotech, I can read studies. I got super interested, and then I always say, and I don't say that lightly, yeah, then sort of the most important day of my life was then a year later. I was in the Caribbean, so disclaimer, in a country where it's legal. Friends of mine had magic mushrooms. I sort of felt comfortable about the science. This was my first trip, and the short version, it was the single most meaningful thing I've ever done.
Wow. Amazing.
So long story. Yeah.
No, great story. Can you share who the German neuroscientist was, or is that something else?
He's very famous and he works for the government, so I'm not 100% sure after what I said if he will be comfortable becoming that sort of.
No problem. Let's not go there. So, can you explain a little bit? Are you a psychedelics company? Are you a mental health company? How do those sort of work together in your?
So after that trip, I go back to that experience. Yeah. So I am an entrepreneur. So I have started a lot of companies. I do invest in companies. My holding is called Apeiron. So I run my own family office, investing actually, just for the background that the people who are watching can sort of understand me a little bit better. So I started with a biotech company, which I co-founded 22 years ago. Jesus, I always realize when I say that I get older. And since then, since the exit, I invested.
You founded companies. You're really a prodigy. You founded companies when you were 7.
That's super nice, and we leave it there. Exactly, we leave it there. And since then, I'm investing, simply I said, in biotech, in the whole fintech, crypto, insurtech as a second pillar, and the third big pillar is what we call deep tech, like space tech a lot, artificial intelligence. So headline is tech and biotech. And so when I came out of my trip, to be honest, the first thing I did, I called my parents. It was a very emotional trip, positively emotional. But the second idea was like, okay, why is that not available? Meaning for people like me, but even more for people who need it. Yeah, because I had the luxury, I came from a happy place. Yeah, and it made even me, and people were always joking, anyway, like Obelix, I fell into a happiness pot when I was young. But so this experience made even me a little bit happier. So I could immediately imagine how positive this could be for for people with mental health issues. So why is that not available? And it should be available. Again, we can come to that in a second in a medical setting. So I was actually looking around, and because there was literally back then, there was no company to invest in or help or support, because there were no companies in that sector. This was I thought about it. I should set up one. And that was sort of the birth idea, or at least the birth impetus for what is today ATAI. And then you also know that we have a stake in Compass, which is particularly dealing with magic mushrooms, which we helped setting up. We were the seed investor, and so on. So what are we? So to be honest, I like obviously the term psychedelic company, because it's sort of the root and the DNA and the heritage. It sounds so old for a very young company, but we also realize positively that there are more compounds, medical drugs, who might be helpful for several mental health indications. And unfortunately, by the way, and I don't know for that's the only pity of Zoom. You don't have really like the sort of interaction with the audience. It's like I guess like how many people are aware of like how big the mental health problem really is, because I wasn't. Meaning, you read headlines, depression is on the rise and addiction is on the rise, but if you look then into the numbers, it's shockingly how many people deal with with some form of mental illness. And then you have the official numbers that more than 300 million people have depression. Several hundred million are addicted to something bad. But the sort of, I don't know if the English term is also gray number, like, or the unofficial number, is way higher, because it's still also a big stigma. People don't talk about their mental health or their mental non-health, their mental non-well-being. So when we came across, back to your question, of other drugs who maybe not deemed like in the core meaning of psychedelic, but who can be very sort of positive for patients with mental health issues. So we sort of broadened a little bit the portfolio and define ourselves now as more like a mental health company with a very strong emphasis, obviously, on psychedelic drugs, but not solely psychedelic drugs.
And all of your companies all of your portfolio companies operate under a shared platform of ATAI. Can you explain sort of how that works?
Well, if you, so I like company building, and so ATAI is sort of some mixture between a holding and an operational company itself. Because if you look at the science, again, psychedelics and other stuff, and by the way, that's my general sort of experience also in biotech, is that you have great scientists, who partly for decades, by the way, worked on these drugs. So it's not that the science stopped after they were made illegal. It became a fringe science, but people were still going on. You have great persons like Deborah Mesh, who's in our team now, and she worked on Ibogaine, by the way, for decades. So it's not that we're reinventing the wheel. So we sort of are based on the work together with the people who did it. But so we're adding sort of the commercial sort of sense, because there is a difference, or not difference, but it's different if you, to do science about a drug and then to get a drug approved as a medical drug. So to deal with the regulators, to design the trials, to raise funds, like all that sort of the company building around the science. So, and we see ourselves as the full service provider. We love to partner with great scientists who bring sort of, say, their asset, their science into the partnership, and we help them building the sort of business and the company around, and that's what we call a platform, like the shared services like trial design, fundraising, whatsoever, finance.
Great. And can you talk a little bit about your investment in Compass and why you chose that, and maybe also touch on a couple of your other portfolio companies in the psychedelic space?
So Compass is sort of special because it was the first one, and it's the one which is not integrated into ATAI. So all the other compounds we can talk about within ATAI are sort of fully integrated. We own the majority. Compass was the very first one, so we have a stake of 25%. are very supportive. Yeah, but it's not that just saying that integrated. So it's meaning what do I like, or how do I would describe them? Meaning, first of all, they're really like together, sort of within ATAI, but also like in the world, the first sort of real psychedelic company ever since the 50s. Yeah, so that's all. Already makes Compass very special. It's also the two founders, George and Katya. They have also a very personal history with the drug. So in their family, so with a very good success. So I think they have the right sort of ethic and also like mission to bring it to people. Yeah.
Great. So there's been very little investment and innovation in mental health since the advent of SSRIs and SNRIs. Any sense as to why? Why has it taken so long to begin looking at other options?
There are several. Yeah, I think there are several reasons. The one reason is that just lately we really define or see mental health as the problem it really is. So actually, and I think there are two reasons, and it almost becomes a philosophical discussion for one of the reasons. So I think what the fact is that if you look at the mental health, the number of mental health patients now, yeah, we have, I don't know, 10, 20, 30 times, meaning an enormous amount more than, for example, in the 60s and 50s. Yeah. So, and I think there are two different reasons. So the one reason, which is sort of the obvious explanation, is that we're diagnosing better. So if you go back to the 50s and 60s, a lot what we call now a mental health issue has been dismissed as, well, go on with your life. Like if you go back to, for example, Europe, to the war, post-war time, most men who came back from war had PTSD. Yeah, most women who lost their husband had mental health issues. Yeah, so but they were not diagnosed. Meaning, I still know my grandfather. I mean, people said, well, he's a little bit melancholic. Yeah, so we had all these. By the way, it's a very interesting thing. Like society is very good in hiding stuff. Yeah. So, and we hid that stuff by using words. Like in Germany, we have, I think, 20 words which sound nice. Yeah, I can't tell them now because they're German. Like, but they all mean you have depression and you're very, very ill. Yeah, but it was, oh, he's a little bit melancholic, stuff like that. Or a usual sentence was like to people, go to the gym, man up. Yeah, you survived the war. Like, why you suffering? Yeah, there was all these sort of what's the English word? All these like pushing that stuff away. Yeah, and being ashamed of it. Yeah, so one thing is diagnosis. So we started over the last 10, 20 years to diagnose mental health problems better. That's one reason. The second reason, though, I personally believe in, yeah, very much, and I think the research of the next decade will prove it, is that we live in a world which is actually not good for our mind. Yeah, so actually worse than maybe the 50s and 60s, although we are better off. That's actually the absurd situation. I think in any meaning you can say, yeah, we are better off. We don't have a war. Well, we have COVID now, but it's not a war. Yeah. So we are, meaning I'm a very big optimist, but even like a realist, I would say, if you look at the numbers, we are better off in our time than 50 years ago. But the time we live in, nevertheless, is very detrimental for mental health. Yeah, mainly I'm shortening it because again we want to touch several points. Yeah, but mainly social media. Social media is super toxic. It makes you unhappy. Yeah, by the way, both. It makes people who use social media because they follow other people unhappy. Yeah, and it makes people who are followed, celebrities, unhappy. Yeah, meaning the one, by the way, so there is my favorite example is there is this rat experiment. So if you put two rats into a cage, and there is a glass window in between, and one is an alpha rat, like a strong rat, and the other one is a weaker rat, just over days, the weaker rat, because it has to watch the stronger rat, although the stronger rat can't hurt it because you have a window in between, yeah, is getting depressive. That means our brain, and I'm very believing that, watching other people, although we know sort of intellectually Instagram is fake, but always seeing people on holiday who are looking better, who have, I don't know, better cars, houses, whatsoever. That permanent comparison is really damaging our brain. But the same, the people who are followed, you might think, oh, but the lucky ones are the ones who are on Instagram. It's very toxic if you derive your confirmation about your value from an external source. So if you are addicted to likes, just as an example. So long story, but like, again, we diagnose better, but the world we live in is very bad for our brain. Yeah. And I think these are the two reasons why over the last 10, 20 years, the number of people who have mental health issues goes up. Yeah. So that's one thing. The second, by the way, is that we start to understand the brain for the first time. So there was also little research, again, because the demand side was not there. Yeah. But also like 20, 30, 40 years ago, all the drug development or the little drug development in mental health was actually done by hit and miss. Yeah, so we didn't really understand what SSRIs are doing, but sort of they seem to work, so we took it. So now that we know the brain better, we sort of can make better drug development, better choices. Yeah, and then lastly, by the way, one other reason was that the group of drugs, namely psychedelics, which does have the potential to help, was blocked out of science or of the commercial science for 30 years. So there was nothing else they found. Yeah. So these are the three reasons I would say why we are sort of in a renaissance of mental health drugs.
Great, thank you. Switching gears, you, Compass, and all of your investment companies are leading a renaissance of for-profit research and activity in the psychedelic space, which until a couple of years ago, the relatively limited funding, but the funding that was there was all nonprofit philanthropic. Can you talk a little bit about, first off, how the for-profit model is going to work when it's a substance that you have one or two or a few administrations and then you're finished, rather than a drug that you need to take on a chronic basis every day for the rest of your life or for an extended period? How do you make money at this?
Okay, so so great that you say it, because that's one of the, meaning I love the topic because obviously, and I'm always very proud of that, I'm a very libertarian capitalist, and I do think ultimately this, by the way, it doesn't mean that capitalism is perfect, but it means it's sort of the most sort of, in my view, it's the better version of a lot of bad alternatives like democracy as well. Like it's always, everything has flaws, but maybe has less flaws than other sort of other regimes or other structures. So having said that, meaning I know that there is this discussion about for-profit, non-profit, whatever. And let me answer that first, because then it's more clear about the pricing in a second. Meaning I think the whole discussion for me at least doesn't make sense, because it starts at the wrong sort of side or at the wrong point, because the only thing ultimately which counts is that we get those drugs who work to the people who need it. And whatever sort of way you go, as long this happens, it's a good way. So you wanna bring it to the people. So having said that, the problem, and we're not gonna change that, and that would be, I always say, it would be a whole different discussion I'm happy to do, is drug approval, can we do that more efficient? Is the FDA sort of perfectly? No, but like, I will not change the FDA, you will not change the FDA, nobody of us will change. So if I accept sort of the structure of the medical system as it is, in order to get those drugs to the people who need it, you need to approve them as a medical drug, and you need to make them available within the medical system. And the approval of a medical drug, of one medical drug, is very, very expensive. You can really, it varies, but like, let's say plus minus $100 to $150 million. So we are at the moment have 7 drugs in various stages of the approval process. That means over years, I somewhat need $700 million to make my drugs approved. And by the way, again, that's the only goal we have, because that's what the patients need. So, and in my point of view, the only way to raise these amounts of money is to do it in a for-profit way. That means offering the people who give me that $700 million, and we already raised more than 150 million, yeah, to make a return. That's the capitalistic way, yeah. So that doesn't say, by the way, for my non-profit is amazing, but it's very hard to raise. But I mean, if you look at through the world's non-profits, yeah, practically none for a single topic has raised that amount. So I admire, and I want to say that here because he's a dear friend, and I'm happy, by the way. I always say it for any single donation, but like there is a non-profit called MAPS, M-A-P-S, yeah. So they work on MDMA, yeah, on one drug, yeah. And brave Rick Doblin, who runs it, like, is fundraising all of his time. And I'm like, hey, you should work on the drug more, and like, you shouldn't need to fundraise that much, yeah. And he doesn't get the money he needs quickly enough for one drug, yeah. Again, I need it for 7. Yeah, so there is no competition. People always want to pit us against each other and say, oh, you against that. It's bullshit. Like, it's really like, we want to bring as many drugs as possible to the market, and therefore we need as much money as possible from all the sources possible. Yeah, so that's my view. By the way, saying, you know, that I will say that, like, whoever listens and who wants to do something in that space but don't want to invest and is on the non-profit side, then go act on it and go on the MAPS website and donate, because then very little people do that. That's, I'm very annoyed about it. I hear from so many people, and you know, we were in another webinar, who like, oh yeah, I'm more for the non-profit one, I'm happy, but I'm saying, have you already donated to MAPS? Because the people don't follow, they always talk, but nobody acts on his beliefs, yeah. And that's what anyway. By the way, for the ones who are watching, if you look behind me, that's the Rick Doblin sort of, how to say, iconic picture. That's the picture behind me, or the artwork is made out of MDMA pills. That's a psychedelic artwork. They are sealed, they can't be used anymore. So yes, going back to your other question. Sorry, I got a little bit emotional on the non-profit discussion, because I think it's a nonsensical discussion. But what was your other question on drug approval?
The question was also about how you actually make money when you have single or few administrations.
Yeah, well, by the way, yes, you do make, this is a fact, like, you do make less money as a pharma company if you have a, which is sad, but like, it's true. I don't want to reject that, but I don't care, because we will make enough money. Yeah, so unfortunately, yeah, because the market is so big. So it's not that I'm people always think capitalists, especially in the pharma world, are sitting there and plotting and like, hey, I want to rather make a, I would say, an ongoing treatment than a solution, which is not really true. We take what we get. And I think I want to break, how do I know what the English term is, but I want to a little bit defend the entire biotech industry. I know so many people in the biotech industry. I never met somebody over 20 years, yeah, and I think I invested in 50 companies, we developed a lot of drugs, like, who sat there and plotted and said, I want to deliberately make a drug which is just working if you take it every day. Unfortunately, that's science, and that's our human body. Some drugs just work if you take it continuously. Some drugs, even more fortunately, like psychedelic, like psilocybin, have the power to heal maybe after 1 or 2 drips. And honestly, every entrepreneur in the biotech world is in it as well, because you want to help people. And you're very happy if you find a solution like we did. So I don't see that at all as a problem, because the market is big enough. Unfortunately, there are so many people who need it, that this will still be a viable business.
So following up on that, I'm weaving in here a number of questions that have been coming in. Given that most of the psychedelics have been around for a long time, how do you deal with intellectual property and patents, and how do you do that? Is there a way of doing this without stifling innovation by other parties?
What was the last verb? Without what with other parties? Stifling?
Without stifling, without sort of making it impossible for others to investigate potential other uses, maybe even better uses sometimes, or other indications, or whatever it might be. And I'm paraphrasing.
Yeah. So it's a good question. It's a very good question. So because it's like, it's a nuanced answer. So first of all, the only way to do for-profit drug development is obviously patents. Yeah, because you have to, if I invest 100 to 150 million in any drug, yeah, to make it approved, I want to have some sort of, I have to have, again, because I need to make a return for investors, because otherwise they would never give it the money to me in the first place. Yeah, so I have to have any form of patent. So this is, by the way, you can say now, and I know that there are some people who don't like the patent sort of existence, yeah, but I give you some negative examples. There are drugs, psychedelic drugs, where you can't get any patents because they are too broadly researched whatsoever, yeah. But the outcome will be that these drugs will never be available because nobody is putting money into them. So be careful what you wish for, yeah. So and by the way, I want to make one side sentence. What I'm very annoyed is too emotional, but I'm a little bit annoyed because I always think patients first. And most of the people who criticize patents and for-profit do not have a mental health illness. These are people who like to shroom on the weekend, yeah, who had a mystical experience, which is great. I did have this as well, yeah, but for whatever reason think there shouldn't be made a business out of it, which is actually extremely egoistic because they're not thinking about the 360 million who do have a problem, yeah, and who will just have access if it's a medical product, yeah. So, and again, no patents, no approval, no patents means no approval means never available for patients. That's as simple as it is. So whoever advocates for no patents is automatically saying this will not be available in the medical system. So now the answer might be, I'd be taking your critical questions, but why not make it broadly available, like free available, yeah? Go to the Netherlands. It is available in the Netherlands. You can go to Amsterdam, and in every coffee shop in Amsterdam, you can buy magic truffles, which is magic mushrooms, yeah? So nevertheless, in the Netherlands, you have the same amount of depressive people who don't take magic mushrooms, also, although the solutions is in the next coffee shop. They just would literally need to go to the next door and get magic mushrooms. Why? Because if you're a depressive person, yeah, you don't do that. One of the characteristics of being depressive is that you don't have an impetus. You go to your doctor. And so as long as it's not in the medical system, 99% of people will be never have the option of being treated with the drug. Yeah. So that's, I think, is a very important background. Yeah. Because if we talk about patents, commercial, nonprofit, we need to always know why we're doing all of that. And we're not doing it that people can have a fun trip on the weekend. Yeah. By the way, you can all do that if you buy a growth kit. Yeah. And nobody's having a patent on the organic stuff, by the way, anyway. So people always think like maybe someday Compass, Katja, George, and I will knock on the door and take away your growth kits. No, it's about medical synthetic psilocybin. Yeah. So everybody who wants that can do that today, to be honest. Yeah. So, but it's about the patients who need it. So back to your question. So we look carefully on indeed drugs which are around since a while, which are maybe around naturally in nature since millions of years, yeah, and try to find ways to build patents around them with good intention, again, because just with patents you can make justify the approval, yeah, and bring it so, and sometimes it works. For example, Compass did find ways, very important, to patent the artificial, the synthetic psilocybin, yeah. Again, does not mean people can't grow their mushrooms anymore, but it means that their way of producing synthetic psilocybin, which is, from my point of view, superior, right, the only way, because it's a very complicated molecule, yeah, is patent protected. So nobody else in the world indeed can produce psilocybin with the Compass way, so to say, yeah. Again, but you need that protection because otherwise it's not justified. By the way, Compass is giving out its drug, obviously, to researchers. This does not mean that people cannot research with that drug. We give it out for free, but it means nobody can make a commercial business based on that synthetic form. And that's, from my point of view, correct, or the right way.
Great, thank you. Where are approvals on all of this? Where are developed countries on approving, where are any countries on approving psychedelics? Will some move before the US FDA? Will the EMA take the lead? Or how's all that going? And how far out are we looking before we're actually able to see therapies based on these substances?
Well, so the most advanced one is MAPS with MDMA. So they are already in phase 3. That is the last phase. Compass is just finishing up its phase 2 for psilocybin. So practically Compass with psilocybin and MDMA, MAPS with MDMA are the most advanced ones. So so you can assume that MDMA is always drug development is always a little bit like a year is nothing. But I hope that both drugs should be available between 3 and 5 years as a treatment. Yeah.
Okay. What do you see is the potential effect of decriminalization? You know, you use the example of mushrooms available in the Netherlands. Will that impact your market?
No.
First of all, by the way, just an important distinction. You know, when you're referring to, you know, you can pick up mushrooms, you know, in shops in Amsterdam. What you're doing, and Compass is doing, and MAPS is doing, is creating a set and setting for with therapeutic support to actually heal people or help people in their healing, which is different from, you know, take this magic pill or magic mushroom, and that in itself you're completely cured laying out on the beach.
Yeah. So it's actually exactly it's more nuanced, more not difficult, more like there are multi levels, as you say. First of all, let's go one step back. First of all. So to your decrim question, that's a good question, because like you have 3 practically, not stages, but 3 pockets or 3 pillars what could be. Yeah. At the moment, these drugs are illegal. Yeah. So we want to make them legal as a medical product. That will still mean they are illegal outside the medical use case. Yeah. To give you an example where that already has happened, and maybe some viewers have tried it once. Yeah. So there is a drug called ketamine. Ketamine is, in the right doses setting, can be very positive for or against depression, and has also other medical qualities. Like in a high dose, it's a good tranquilizer, up to a narcotic, whatever. And it's completely legal since decades in hospitals. But if you take ketamine, because it's also sort of some people take it as a party drug. If you take ketamine outside the hospitals, it's illegal. Just saying, so it can well be that a drug is at the same time legal in a hospital and illegal outside. And decriminalize that, then you could have a complete legality where you say, look, a drug is completely free, can be sold everywhere. Yeah. And the fourth thing, what you're saying is sort of in between, is like decriminalization. Decriminalization means it's not legal, so you cannot sell it, but you are not convicted, I think is the English term, where you don't have a problem if you use it. So my view on psychedelics is they should be decriminalized, because nobody honestly should go to jail for magic mushrooms, for homegrowns, whatever. Because meaning compared to alcohol, meaning it makes me angry that we sort of allow alcohol, whatever. So decriminalization is absolutely fine. Yeah. I'm not for legalization though, yeah, that it's sold everywhere, because it's very powerful drugs, yeah, and the real benefit comes from using it with a therapist, with a doctor together, again in the medical setting, yeah, and that would be lost if it's sold everywhere. Again, and I go back to the Netherlands where it is completely legal, yeah, it gets lost for the medical world. By the way, and now make your case, because you said, what is the risk? I personally think that even if it ever were legal completely, yeah, there would still be a huge medical business. Because again, if I go back to the Netherlands, I think we need to always, again, and sorry when I repeat myself, think about whom we're talking. People who talk about recreational use, people who talk about that for them it's important that it's decriminalized, again, what I'm for, but it's a tiny, tiny, tiny fraction of our population. And I would say 99% of the people, maybe 98% of the people would never ever, if I look my parents, yeah, if I look, especially by the way, on older people, I think psychedelics can have a very positive impact on the life quality of older people, yeah. They will never do that. They will not shroom on the beach. They will not, you know what I mean? Like, they want it in the medical system. So even if it were legal, look at the Netherlands, they're not going to go to a coffee shop and trip on their own. Like, and by the way, now comes your point. Sorry when I'm always talking very long. Psychedelics have this beautiful quality, which shows how sort of deep they go. That it's not like a cancer drug. You don't take it and it either works or not, and you don't even feel it. So the healing is combined, or the healing goes hand in hand with very deep psychological work. Some people like me, I'm very on the spiritual side personally, would call it mystical, religious, maybe even, yeah. So, and this work needs to be or should be supported by a therapist, yeah. And by the way, if you look at the history of psychedelic drugs, where they were used, and don't mean history like lately, but like thousands of years back, yeah, they were always used in a shamanic, in a ritualized context, always with people guiding you through it. So it's not a new idea we have that you need a therapist, yeah, because the pre-work, meaning there is, if you go to shamanic cultures, there was fasting involved, preparation, yeah. And then if you go to the trip itself, where you have somebody guiding you through the trip, but then you have all the post-integration work, where again, you need somebody, yeah. So, and we're developing a concept, not just based on the approval of a drug, but also of the concept around. And that's also, if you want to go back to the business side, that's additional IP, intellectual property we are developing, how these drugs. And by the way, we live in a world, and I think it's great, where technology can be very bad for you, but can be very good for you. It's always how we use it. Yeah, yeah. Instagram is very bad, but like there can be great apps. By the way, if you want to look at them, invest in a company called Unmind. They help already now with technology at workplaces. So there is, yeah, you can use technology to integrate it. So long story short, it's a complicated drug in a positive meaning, because it does add so much to your life. But I'm repeating myself. But by the way, for everybody who watches, there are countries where it's legal, so you can go to the Netherlands, you can go to a lot of countries in the Caribbean, but do it with a guide. The guide must, if you're like a happy person, I would say, like I had an amazing friend as a guide, so it must not be a therapist, like a doctor, like, but it must somebody who takes you to the trip to make the most out of it.
Great, thanks. You mentioned 7 drugs that you're attempting to take through the regulatory approval process. Beyond psilocybin, can you talk about some or all of the others and how you view them to be different therapeutically in terms of versus the potential of psilocybin?
Okay, so let's go to some. By the way, you want to make a hard cut? I want to look at the time. Just saying, like, we have an hour, or what's the, or we go just on how long?
Yeah, we have an hour. We'll be going to the top of the hour.
Or people drop out when they don't want to hear us anymore.
But I think we could talk for 5 hours and people wouldn't drop out.
So one of my favorite drugs is Ibogaine. Not my favorite, in that case, not my favorite drug personally, but what it does, because it's a very strong psychedelic, different than other psychedelics. The use itself must not be pleasant. Yeah, it does. By the way, also very important, different than other psychedelics, it does involve some risk. So this has to be, it's not an option here, administered with a doctor. However, it's actually, as far as I'm aware, I'm always cautious with extreme sentences, but I think it's the only drug known which is dissolving addiction, potentially already after one trip. So you can use Ibogaine for very for dissolving very strong addiction, including, which is a huge topic, opioid addiction. Yeah. And we are entering phase 2 with Ibogaine, again, against addiction of opioids. So that's one of our drugs. I already told you that ketamine is in general, so the so-called racemic version of ketamine is already available and legal. But we are hopeful that we're developing a better version of ketamine, which is called R-ketamine, which has just like a stronger antidepressant effect than the original ketamine, and maybe to be seen that low of a dissociative effect that this could be. And the question is, do you count ketamine is a psychedelic. Some would say yes, some would say no, but it could be one of these kind of drugs which could be used at home, without a therapist, if we can prove that with our form of ketamine, the dissociative effect is little enough that you can do it without somebody. Then we actually have, which is maybe fancy to say, we're looking as well at sort of designing, because at the moment the whole players in the industry, everybody's harvesting and working on drugs and work which has already been out there, but we are even looking at designing with artificial intelligence new psychedelics, so to say, sort of with special characteristics. And by the way, maybe hopefully I did answer the question indirectly with Ibogaine, why we working on different drugs, because every person is different, every disease is different, so there is no one fits all category. I think psilocybin, I personally like to say, but it's not a scientific thing what I'm saying now, it's more like my personal view on it, is a little bit like a broad spectrum antibiotics. I think psilocybin is sort of helping for a lot or most of the mental health stuff, so it always makes them better. But then if you take addiction, if it's a very severe form, Ibogaine might be better than psilocybin. Like, so it's very, by the way, this is, again, I'm always coming back to that. I don't want to repeat myself, but I want to show you how important it is that you're taking it with the doctor, because he can also, he knows you, and he might say, look, for you, DMT is the right thing. For you, you need Ibogaine. For you, we do a psychedelic. Psilocybin. By the way, there might even people where SSRIs are the right thing. I'm very much on, it's not a one thing fit all, and like once psilocybin is approved, everything else is meaningless. Unfortunately, again, I can tell you of 20 years of drug developments, both our body and our mind are fucking complicated. And it's good that we have several tools available, and it's good that we have doctors out there. And by the way, one point I forgot, by the way, that's just coming back to your question with medical approval, what people also always forget, it's a cost question. So again, most people who are dismissing the idea of medical psychedelics are actually rich enough to go to the Caribbean. And I know that I'm privileged. So I could go, I've been able to go to a country for my first trip, and I can do it whenever I want, because I'm well off enough. I can go somewhere where it's legal and organize it for me. But again, this is not what every person can. So, and the good thing, once it's a medical drug, it is paid by the government. So it's in the healthcare system. So the drug is paid, the therapist is paid, So that's a very important point. Again, a lot of people who are like, hey, I do it once a year in the Caribbean in my fancy hotel, they forget this is not what everybody can afford.
Just to clarify something there, it's paid for by government healthcare systems in countries that have government payer systems. In the U.S., as an example, it's kind of a mix of private and government.
So first of all, so I have to say that I'm blessed that I'm German. In any ways, we do have a very, very good healthcare system. I know that not every healthcare system is that good, but even the US partly at least has payers, and we're already in touch with payers to make it as good as possible available in the system. Again, I'm always saying we're not responsible for the system. Would you ask me? The US healthcare system needs a complete makeover. So I think we would all agree on that. I won't change that, but within the existing system, I try to deliver the best solution.
Thanks. There have been several questions related to the whole IP question, but and they're generally not looking at it as whether IP is good or bad. Can you just clarify what is being patented? Is it a synthetic version of a natural drug? Is it a new version of a natural drug which is chemically different? Is it a particular method of synthesizing, so others can synthesize a different way? Just so people understand what the issue is.
So you have three principal ways of obtaining patents in the biotech world. And ideally, as an entrepreneur, you want to have all three of them. So the one is like if you have a new chemical entity. So you really discover a new molecule. which obviously is not possible with most psychedelics we talked about because they're widely known. Yeah, it, by the way, will be possible if what I just said, if we design new molecules which are really new. Yeah, so one option is you design new molecules. Yeah, or you mentioned it, you change existing molecules. One famous way of changing is to make a so-called deuterated version, which doesn't change the characteristics of the molecule, but in a legal and chemical terms makes it a new molecule. So this, for example, did not work with psilocybin. Yeah. So second sort of way of getting patents is that you patent the synthetic process of producing a natural version of it. That makes sense once the synthetic process is very complicated. If it's super easy, little to patent. Yeah, again, because you need to be novel. The whole patent system is novel. So in psilocybin, Compass was able to patent the synthetic sort of production process for a form of psilocybin. That, by the way, means if somebody would have another process, totally fine. But this particular process Compass is using is patented. And then the third very important is that you also can patent an indication if it's novel. So if you come up with novel ideas where for indications where this drug can help, you can patent that indication for you. So that means even if there are multiple drugs on the market, by the way, this is the reason if you look at the pharma world, why there are some drugs who have the same content with different brands at the market. Because that means if the drug works for several indications, but one pharma company paid for this indication and the other one for this, then although it's the same drug in it, the doctor has to use brand number one if it's for the heart and brand number two if it's whatever. You know what I mean? Like so you can, it could well be that for some psychedelics in 10 years there are 3 brands on the market, and doctors have to use brand A if they use it for depression, brand B, blah blah, if they use it for addiction, because different people paid for it. Yeah. So these are the 3 pillars. Yeah. Indication, synthetic production process, and ideally you have a new chemical entity. And we try obviously to combine all these 3s. It doesn't work for all psychedelics, again, because some are very old, but some are new. Like, yeah, if that helped.
Great, great. And as we come toward the top of the hour, we have a few more minutes here. And what are you worried about?
In terms of psychedelics, or in terms of
yeah, not your own deeper existential issues. We could go on for hours, all of us, on that. But no, in terms of psychedelics and what you're doing and what you're seeing in the space, and
sometimes, and again, I don't want to, because I know that some people will misinterpret it, yeah, and say, oh, he's saying that because he wants to do commercial business. But like, again, because what I really want, I want it to be available for patients, yeah, and it's all going very well, but it's almost going that well that I fear, and again, I wish everybody, because I did it, so this is I'm really hoping that I get it across now what I'm saying, that yeah, that I wish everybody who wants to try it in a country where it's legal with a therapist to get a great psychedelic trip. But if it's too wildly sort of tested before it's approved, and if people maybe not doing it as carefully as I wish for them to do it, throwing, I don't know, I heard of ayahuasca parties in New York where wannabe shamans, do that, there can things happen. There can be accidents. There can be so, and I'm worried a little bit about the headline risk of, I don't know, bus driver on psychedelics has accident with school bus. Yeah, that's the horrible headline. Yeah, you would always argue, by the way, I would always argue, well, this happens with alcohol a lot. Yeah, but unfortunately, we live in a media world where something novel, which we see, by the way, with the coronavirus, is sort of, this would be a headline everywhere. Although you say a drunk bus driver maybe kills somebody every day, yeah. So you know what I mean. Like, so these are very, very powerful drugs. These make them so beautiful, yeah. But we also always need to wear. I mean, I just heard now that in the new TV series Billions, they talk about magic mushrooms on Netflix. I was like, holy shit, that's going a little bit too fast.
Right, and I've seen that episode, and it's disturbing. It doesn't present it in a very positive
Exactly,
light.
and by the way, then you have movies or things which completely sort of miss the spiritual part and paint it too crazy and all of that. So yeah.
Well, Christian, thank you so much. I mean, this has been fantastic. We're deeply, deeply grateful for you doing this. To let people know, we have our next global conference call webinar is Tuesday, June 16th at the same time. Our guest will be Rachel Yehuda, who's a pioneering researcher in PTSD and who did work, the original pioneering work on epigenetic trauma transfer in children of Holocaust survivors, has over 250 published papers, is professor and director of Traumatic Stress Studies Division at Mount Sinai, where they're creating a psychedelic research center, and really important in this space, runs the Bronx VA mental health program and is doing pioneering work there in testing MDMA for PTSD.
Yes, she's
again,
awesome. I know her. So I can market your call. It will be a great call with her. So you should all dial in.
Great. Thank you again, Christian. There will be a recording of the call available to everyone, and you can share that. And to YPOers, or if you're not yet in the Psychedelic Medicine for Mental Health group, I would encourage you to join, where this will be posted, and there's a lot of other information. Thank you, Christian.
Thank you very
Thank you,
much.
everyone.
Yeah, it was amazing. Yeah, thanks for your time. I really enjoyed it.
Great. Thank you. Take care.
Bye-bye.
Bye.